Having my elder sis pass on after 9 months of discovery of uterus cancer, and I having the same symptom as her, having heavy flu and pain in abdomen, I requested my gynae to give me a screening. And true enough, after the biopsies, it was confirmed that I was in the first stage of uterus cancer.
Uterine cancer remains to be the highest and the most common cancer affecting women in Singapore, and it continues to have an upgrowing trend.
In Singapore as a whole, it is actually number 4, the most common cancer in females. In the year, the recent statistics shows that about nearly 2,000 women was diagnosed with uterine cancer in the last 3 years.
As my gynae know about my family history that my sis passed on because of uterus cancer, even though it's only first stage of cancer, she decided that I should remove my womb as well as some of the lymph node to avoid any spreading. Actually, I feel very sad because I've been working for so many years, and I thought that this is a time that when my children is growing up and I should be kind of enjoying my life instead of having cancer. So this is how I feel. But then, as what I say, I just have to go for treatment and move on and just cling to my God for protection.
The first thing she would need to do is to seek medical advice, and this can be her own general practitioner or even the doctors in the polyclinic. And the doctors obviously initially will take a history to assess whether she is at risk of having uterine cancer. And if she is found maybe to have a high risk, further investigation can be done. But this is usually advisable to be done in a specialist clinic. And for example, referring her to a gynecology clinic where further investigation can be done. Not two women are the same, and not two history of irregular bleeding is the same. Irregular bleeding most commonly are not due to cancer, but it is very important if you do have these signs and symptoms to seek advice so that we can reassure you that the bleeding may be due to something else rather than uterine cancer.
Unfortunately, there is no effective screening method for uterine cancer. Fortunately, uterine cancer is still detected fairly early because of the abnormal vaginal bleeding. The treatment for uterine cancer is dependent on the stage. Stage 1 uterine cancer is usually adequately treated with surgery. Stage 2, 3 or 4 uterine cancers are best treated with surgery, chemotherapy and/or radiation.
The good thing about uterine cancer is that most of the symptoms comes early, and majority of uterine cancer is diagnosed early. That means in the early stages, stages 1, stages 2, where the survival rate is actually high. Stage 1, for example, has a survival rate of about 90% cure, at least for the first 5 years.
I really enjoy my day. Every day when I wake up, I'm very thankful. I thank my God that I was given another day, and I am very positive now. I'll do my regular exercise. I go for my daily prayer. I just watch my diet and try to be happy.
Cancer does not need to be feared. There are many different treatments that are available for patients suffering cancer. The most important thing is to remember to eat well, stay strong, and continue to find the best treatment options for themselves and live well with their family members.
Seek advice from your doctor early, because the earlier you go, the earlier we can fight this cancer together.
Be positive, look forward, and spend quality time that you have now. I'm Irene, and the survivor of uterus cancer.